had surgery here at MedicalPoint 3 weeks ago, and it was quite a challenging surgery for colon and liver cancer. And now 3 weeks after, I have my final controls and very happy with the results and how the entire process went.
Hello, my name is John. I'm from Canada. I came to Turkey for 2 reasons. One is to support my wife, Anastasia, who was diagnosed in January with a fairly aggressive liver colon cancer. Throughout the process in Turkey, going to many different locations, meeting with many oncologists and surgeons, we found that MedicalPoint, and in particular Dr. Jan, to be not only very skilled and knowledgeable, but also knowledgeable in the human sense and very empathetic to our situation in a very sincere way that made us feel very much informed, very much in control, and in good hands.
Hello, I'm Dr. Can Karaca, a specialist in general surgery. Anastasia's story is actually a bit long, and it's a story that started off with some problems, but since it ended in a way that made everyone happy, it brought joy to all of us. She was actually diagnosed at an age we wouldn't really expect. At 42, she developed a colon tumor. When she first noticed the symptoms, she went to family medicine in Canada, but her complaints weren't really taken seriously. Frankly, the necessary tests were done quite late. Even though her symptoms started in March 2024, despite her complaints, it wasn't until January 2025 that she was finally able to get a diagnosis. Of course, in the meantime, because the diagnosis was delayed, the colon cancer had already spread to the liver, and not just to one side, but to both sides. In cases like this, what we usually recommend first is to start chemotherapy, but even this wasn't recommended to the patient in Canada. The patient, wanting to get a second opinion, and since her family lives here, comes to Turkey, and that's how our paths crossed.
Before we find the hospital, we went to multiple other hospitals in different cities and talked to different surgeons. The MedicalPoint staff and especially international department was very helpful before we came here, and the surgeon answered all the questions even prior to our initial visit. So that was a big part for us in taking our decision to proceed with the surgery here.
Anastasia went through some chemotherapy for 5 weeks, and subsequently 3 weeks ago had a fairly major liver and colon surgery.
Chemotherapy is given to prevent the recurrence of the disease, and actually, it's a very good decision. Before starting this process surgically, for these kinds of patients, to prevent recurrences after surgery, or let me correct that, to reduce them, they need to receive chemotherapy. After the patient completed chemotherapy, she came to us to be evaluated for surgery. When she came to us, the tumors were mostly located on the right side of the liver, but there were also multiple metastases on the left side. And at the same time, the colon tumor was still in its original place. One of the challenges awaiting us was the patient's total liver volume, because after liver surgeries, the problem that scares us the most is whether the remaining liver volume will be sufficient for the patient or not. And even though we're in the 21st century, there is unfortunately no objective technique that allows us to predict this. Unfortunately, there isn't. We try to make predictions based on liver volumes, but these really are just estimates. And the patient's initial liver volume was also quite limited, since interventions would be performed on both sides of the liver simultaneously, because simultaneous intervention would be done on both sides of the liver. To be honest, this had started to keep us up at night. Fortunately, what we saw during the surgery was not exactly the same as the preoperative images. It was actually better, so we were able to preserve the portion of the patient's liver that could be saved, and we intervened on the tumors on both sides. We surgically removed all the tumors on the right side. As for the tumor on the left side, with the help of radiology, we used a method called radiofrequency ablation, where we heat around the tumor using a microwave technique, causing damage with heat, and applied a method aimed at destroying the tumor. In the same surgery, we also removed the patient's colon tumor and concluded the operation. After the surgery, what worried us most was still the possibility of liver failure, because even though we knew that the failure would be temporary, this insufficiency, while it lasted, would also put our stitches in the colon at risk, because the proteins necessary for our healing are produced. The main source is the liver. Thank goodness, nothing like that happened. We discharged our patient without any problems. At the end of the 5th day, she came for her second week checkup. The second-week checkup is important because the liver, after these kinds of surgeries, heals the fastest in the first 2 weeks. We want to see these kinds of patients at the end of 2 weeks to get a real picture of their condition. And when she came at the end of the 2 weeks, not only had her liver recovered completely, but even more encouraging, the tumor marker, which was measured at 849 when chemotherapy started, and when we measured it before the surgery, it had been stuck around 64. The CEA level had dropped below normal, that is, below 5. It had decreased to 4.8. This is also, in fact, numerical proof that we didn't leave any detectable disease behind. From now on, the fight will be to prevent the disease from coming back. For that, we'll meet our oncologists.
Everything went very well, and after 3 weeks, I'm having my final controls here and very happy with the results.
Dr. Jan did an exceptional job, and Anastasia is healing and doing very well, and we're very satisfied with the outcome.
The staff and nurses, everyone was very helpful. Everything went way better than we expected, and everyone was very attentive.
I also had some medical requirements here. I have a long-standing hiatal hernia for the past 20 years and have had some symptoms in which I wanted to check on. As such, we did an oral endoscopy. I had a great experience. I've had, I would say, over a dozen scopes over the course of my life. And in particular, I would quite regularly have a bad experience with the scope. I would often wake up and, it's not very pleasant when that happens. Having shared that with the anesthetist team, not only did I not wake up during the procedure, but it was just perfectly easy, best scope that I have had. And after the procedure concluded, I got a full report, and it was fabulous. Being English speaking from Canada, it can be hard to navigate the hospital, and of course would not have been able to do so without the support of the international team, in particular Ahmed and Lisa and others on the team. Were just exceptional to work with. They guided me around, they took care of me, they made sure I didn't get lost and made sure I was going to the right places, and assisted me throughout the entire process, which made it as pleasurable it can be when you're in a hospital environment. Thank you so much, MedicalPoint, for everything that you've done for myself and in particular my wife, Anastasia. We're grateful.